Telemedicine is what they call a really disruptive influence in what we understand as being clinical care. It's redefining the paradigm of how we deliver health, and if you think that sounds familiar, then yes, it's very much like the Uberification of healthcare. It's very flexible, and the workforce is very flexible. And really, we should be delivering high quality healthcare conveniently and inexpensively, and certainly new technologies, disruptive technologies like telemedicine, allow us to do that. So we set up the Victorian Stroke Telemedicine service, and as you can see, it's operational across 16 hospitals in Victoria. So how does VST actually work in sort of day-to-day practice? So what happens is when someone is having an acute stroke, themselves or most likely friends or family will call the ambulance service. They'll call 000. The paramedics will then arrive on scene and then notify the hospital in advance that they're bringing someone in with acute stroke. When they arrive at the hospital, there's then a protocol that they follow where they are quickly assessed. They go directly into the CT scanner, and they have a plain CT scan of the brain, but they also have what's called a CT angiogram where we can look at the blood vessels inside the head as well. As that's happening, they're calling a 1300 number, which is operational across all 16 hospitals, 1300 Telemed, and that number will then directly access to a neurologist who's on call, neurologist roster, which is on call for 24/7. The neurologist on call will answer the phone, take some clinical details, and then fire up their computer, and that could be at home, could be like myself here in the office, could be anywhere really. And then we'll look at the brain scans, and then we'll dial into the telemedicine cart, which you can see here, and then we'll then have a consultation, a clinical consultation with the staff in the emergency department, and also with the patient, but also with the carers or family, whoever's there with the patient. And one of the key things that we do as part of that consult is actually we make a diagnosis. And that's a big issue for a lot of these small regional hospitals that don't have sophisticated stroke services. The majority of them, in fact, don't have any neurologists. And so actually giving them a diagnosis, which could be stroke, it may not be stroke, it may be a diagnosis of some other condition that's happening. But being able to do that is obviously a very important part of the consultation process. If we do decide that they've had a stroke, we then need to decide what sort of stroke it was, and in fact, do they need to go on to have other treatment, in particular clot busting treatment, or stroke thrombolysis as we call it, or do they in fact need to have that as well as being transferred to a large metropolitan hospital that can do endovascular clot retrieval? In other words, putting a little catheter into the brain, grabbing the clot and pulling it out, which is required for some patients to unplug the artery. These are some of sort of the local newspapers talking about patients who have done really, really well in their hospitals. This guy over here, Damien was down in Traralgon, and he was on the football field. In fact, he was at footy training when he had his stroke. He collapsed. He was taken into Latrobe Regional Hospital in Traralgon, and he was diagnosed as having a blood clot blocking his brain artery. Pardon me. He was treated with clot busting therapy, but needed to be transferred up to the Royal Melbourne Hospital, where he underwent further treatment, and within literally a month or so he was back on the footy field playing football again. So without the presence of VST to facilitate that acute stroke care, he would have been left a severely disabled young man. So that was obviously one of a number of fantastic outcomes that we've had with this VST service. We guesstimate that there's around 23,000 patients in regional Australia who are having an acute stroke, and obviously not all of those are going to be living in close proximity to a regional hospital, but we think there's a substantial proportion of those that we can actually access, and we're very keen to spread out to all these hospitals with a much larger roster of neurologists, and deliver acute stroke care. So our sort of guiding principle in all this is that no stroke should be untreated in Australia, and we're really trying to facilitate that with our work with the federal government and also with state governments. So there's a lot happening. There's a lot under the surface that is more to come, but hopefully I've given you a flavour of what we're doing at the moment that's new and innovative, and also what is also to come in the future.